Imagine this. A dull ache starts deep within your jaw. At first, it's just an annoyance, a persistent throb that you try to ignore, hoping it will vanish as mysteriously as it appeared. But it doesn't. Instead, it intensifies. It morphs into a searing, throbbing fire, a relentless hammering behind your eye, a pressure building in your skull that feels like it's trying to explode. Every beat of your heart sends a fresh wave of agony through your face. Eating becomes an impossibility. Sleep a forgotten luxury. Your entire world shrinks to the pulsating epicenter of that tooth. Your breath begins to carry a foul odor, a metallic, putrid stench that even you can't escape. Your cheek swells, stretching taut and shiny, hot to the touch. The pain, once a localized torment, now radiates, seizing your head, your ear, your throat. You are beyond miserable. You are desperate. You are in the medieval world. And this, my friends, is just the beginning of your worst nightmare, and if you find yourself utterly captivated, perhaps a little horrified, by this dive into the dark abyss of historical suffering, then make sure you hit that subscribe button, ring the notification bell, and join the historian's sleepless community. We unravel the forgotten horrors, the untold stories, and the often grim realities of the past, ensuring that we never take our modern comforts for granted. Your support helps us pull back the curtain on these fascinating, albeit often terrifying, chapters of human history. Now, back to that throbbing, infected medieval tooth. The medieval period, stretching roughly from the 5th to the 15th century, was an era defined by struggle, by resilience, and by a profound, pervasive ignorance regarding the fundamental mechanisms of the human body and the very nature of disease. It was a world utterly devoid of germ theory, a concept so revolutionary and utterly essential to modern medicine that its absence alone guaranteed widespread suffering from even the most minor afflictions. Microbes, bacteria, viruses, these were unseen enemies, their existence utterly unknown, their devastating impact attributed to everything from divine wrath to an imbalance of bodily humors, from ill winds to demonic possession. This profound lack of understanding permeated every aspect of health and illness, and nowhere was it more acutely, more viscerally apparent than in the realm of dentistry, or, more accurately, in the complete and utter lack thereof. Consider the baseline for pain management in this age. There was no Novocaine, no lidocaine, no opioid analgesics, no ibuprofen, no acetaminophen. The most potent painkiller at hand was often alcohol, crude and limited in its efficacy, offering only a fleeting, dulled sense of reality before the full, unadulterated torrent of agony returned. Opium, derived from the poppy, existed, known to some physicians and apothecaries, but its use was fraught with danger, its dosage unpredictable, its supply often scarce, and its understanding rudimentary. It was certainly not a readily available panacea for the common man or woman suffering from a raging toothache. Other herbal concoctions, often involving mandrake, henbane, or belladonna, were known for their narcotic or sedative properties. But these were poisons. Miscalculation meant death, and even when carefully administered, they often induced delirium, vomiting, and a state of semi-consciousness that was arguably as terrifying as the pain it sought to suppress, to experience. A severe toothache in the medieval era was to confront pain in its purest, most unmitigated form. It was to live through a torment that would reduce most modern individuals to a whimpering, sobbing wreck, begging for release, any release, from the relentless agony. The dental problems themselves were ubiquitous, an almost inescapable part of life for nearly everyone, regardless of social standing. While the rich might have access to different foods, and perhaps slightly more attentive, albeit still primitive, caregivers, they were no less susceptible to the ravages of oral disease. the diet of the medieval peasant, the vast majority of the population, was coarse and abrasive. Staples included unleavened breads, often made from coarsely ground grains that contained small fragments of millstone grit. Imagine chewing on bread that slowly, imperceptibly ground down the enamel of your teeth, creating fissures and vulnerabilities. This constant abrasion weakened the teeth, making them more susceptible to decay and fracture. Vegetables often pickled or salted, and meats, usually smoked or dried, were tough and required extensive chewing. While refined sugar was largely absent from the common diet for much of the medieval period, a major factor in modern dental decay, natural. Sugars from honey, fruits, and fermented beverages like ale and mead were still present. These fermentable carbohydrates provided a feast for the bacteria already present in the mouth, leading to the formation of acids that dissolved tooth enamel. Furthermore, deficiencies in essential vitamins, particularly vitamin C, could lead to scurvy, a debilitating disease that manifested with bleeding gums, loosening teeth, and painful oral sores. It wasn't just about what they ate, but how it was prepared and the nutritional deficiencies that came with a monotonous, often inadequate, diet. And then there was hygiene, or, more precisely, the almost total absence of it by any modern standard. The concept of regular, thorough oral hygiene as a preventative measure simply did not exist. There were no toothbrushes as we know them, no fluoride toothpaste, no dental floss. People might occasionally chew on specific twigs or herbs, use a rough cloth to wipe their teeth, or rinse their mouths with water, wine, or vinegar, some in a truly desperate attempt to cleanse their mouths, even resorted to rinsing with urine, believing its ammonia content offered some purifying effect, a practice that speaks volumes about the sheer desperation and lack of effective alternatives. Plaque and tartar would build up unhindered, forming hard, calcified deposits that inflamed the gums, leading to gingivitis and eventually periodontal disease. Gums would recede, teeth would loosen, and pockets of infection would form around the roots. The breath of even the most aristocratic individual would, by modern standards, be utterly foul, a constant reminder of the rotting, infected landscape within their mouths. This pervasive lack of hygiene, coupled with the abrasive diet, created an environment ripe for the most common and devastating dental affliction, tooth decay or dental caries. A small cavity, barely noticeable at first, would quickly deepen. Without any intervention, the decay would breach the enamel, then the dentin, eventually reaching the pulp chamber, the soft, sensitive core of the tooth where nerves and blood vessels reside. Once the pulp was infected, the pain would become unbearable, constant, unyielding. This infection would then spread, leading to a dental abscess, a pocket of pus forming at the root of the tooth or in the surrounding bone. This abscess was not just agonizingly painful, it was a ticking time bomb. The swelling would become grotesque, distorting the face. The pus, if not drained, would seek an exit, often creating a fistula, a small tunnel, through the gum or even the skin of the face, constantly oozing putrid fluid. But far more dangerous was the internal spread of infection. A dental abscess, left untreated, could lead to cellulitis, a rapidly spreading bacterial infection of the soft tissues, or even Ludwig's angina, a severe and potentially fatal infection of the tissues in the floor of the mouth and neck, which could compromise the airway. The bacteria could enter the bloodstream, leading to sepsis, a systemic inflammatory response that often resulted in organ failure and a slow, agonizing death. They could travel to the brain, causing a brain abscess, or to the heart, leading to endocarditis. A simple toothache, ignored or inadequately treated, was a common pathway to a terrifying, painful demise in the medieval world. The horror cannot be overstated. It wasn't just discomfort. It was a genuine threat to life itself. So, who did one turn to when the excruciating agony of a toothache became utterly unbearable, when the swelling began to obscure one's vision, or when the putrid taste of pus filled one's mouth? The answer is as grim as the problem itself. There was no specialized profession of dentist in the medieval period. Dental care, such as it was, fell into the purview of a disparate, often unqualified, and usually terrifying array of individuals. The most common, and perhaps the least unskilled, were the barber surgeons. These were not the refined medical professionals of today, but rather general practitioners who combined the mundane task of shaving and haircutting with the often brutal practice of minor surgery. They were tradesmen, learning their craft through apprenticeship, not scholarly study. Their shops, often identifiable by the red and white striped pole, symbolizing blood and bandages, were scenes of both everyday grooming and desperate medical interventions. A barber surgeon might lance a boil, set a bone, perform bloodletting, and yes, extract a tooth. Their understanding of anatomy was rudimentary, their knowledge of antisepsis non-existent. Their tools were crude, often shared with their hair-cutting implements, and almost certainly unsterilized, if the concept of sterilization had even flickered in the minds of anyone at the time. The barber surgeon represented the slightly more legitimate end of the spectrum, still a terrifying prospect, but at least offering some semblance of professional competence compared to other options. They were pragmatic, dealing with the visible, external manifestations of disease, and a rotten tooth, with its visible decay and agonizing pain, fell squarely into their practical domain. Beyond the barber surgeons, the options became even more desperate. Monks and other clergy initially played a significant role in medicine, as monasteries were centers of learning and possessed ancient texts, including some on herbal medicine. However, their involvement in surgical procedures, particularly those involving blood, was gradually curtailed by church decrees, such as the Council of Tours in 1163, which declared, "The Church abhors bloodshed." This pushed surgical practices, including tooth extractions, largely out of the hands of educated clerics and into the hands of the less learned, more practical tradesmen like the barber surgeons. While some religious individuals might still offer palliative care through prayer or herbal remedies, direct surgical intervention by clergy became rare. Then there were the ** local healers, or wise women, ** often figures of superstition and folk medicine. These individuals might offer herbal poultices, charms, or incantations, attempting to alleviate pain or ward off the perceived evil spirits causing the toothache. Their methods were steeped in tradition and folklore, offering psychological comfort, more than genuine medical efficacy. For a raging infection, their remedies were utterly powerless, but for minor discomfort, they might have offered some transient relief, or, at the very least, a sense of having done something. Their knowledge, passed down orally, often contained snippets of useful herbal lore, mixed with copious amounts of superstition. In the direst of circumstances, when all else failed and the agony became utterly intolerable, a desperate individual might turn to a blacksmith or even an executioner. These individuals possessed the necessary brute strength and, crucially, access to large, sturdy pliers and tongs designed for bending metal or inflicting punishment. The sheer desperation required to seek out such an intervention is almost unimaginable. Imagine the scene: a blacksmith, accustomed to wrestling with molten iron, applying his formidable grip and equally formidable tools to your jaw. There would be no finesse, no attempt at preservation, just brute force applied with horrifying intent to rip the offending tooth from its socket. The risks were colossal: a shattered jawbone, multiple teeth ripped out, uncontrolled bleeding, and almost guaranteed infection. This was the absolute last resort, a choice born of an agony so profound that the risk of further, possibly fatal, injury seemed a preferable alternative to enduring the relentless, unyielding pain. The screams would echo through the forge, a testament to a world where suffering was a constant companion and crude remedies were the only hope. And, of course, the medieval landscape was dotted with traveling quacks and mountebanks. These charlatans, often with flashy appearances and silver tongues, would set up temporary stalls in town squares, hawking miraculous elixirs and performing theatrical extractions designed to impress and deceive. They would often employ sleight of hand, secretly dropping a pre-pulled, decaying tooth into a basin while pretending to extract one from a stooge or a gullible victim. Their cures were usually worthless, their remedies often dangerous, and their extractions performed with a complete disregard for the patient's well-being, leaving behind a trail of worsened conditions and empty pockets. They preyed on the desperate, on those who had exhausted all other avenues and were willing to believe in any promise, no matter how outlandish, to escape their agony. Their presence highlights the profound vulnerability of the medieval populace to exploitation in the face of widespread suffering and ignorance. Finally, while university-trained physicians existed in the medieval period, particularly towards the later centuries, their focus was primarily theoretical. They studied ancient texts, diagnosed based on humoral theory, and prescribed remedies, but they considered manual procedures, like surgery and tooth extraction, beneath their dignity. This division between learned physicians and manual practitioners meant that the most academically trained minds were often the least equipped or willing to perform the direct interventions needed for dental problems. They would certainly not get their hands dirty with a tooth. Now, let's talk about the instruments. The very thought of them is enough to send shivers down one's spine. They were more akin to torture devices than medical implements, designed for brute force rather than delicate precision. The most infamous, the poster child for medieval dental horror, was the tooth key. Invented in the 17th century, it actually makes its appearance somewhat later than the strict medieval period, but its precursors and the spirit of its design were certainly present in earlier, cruder tools. It consisted of a handle, a metal shaft, and a claw-like hook at the end, which was meant to be placed over the top of the tooth. The practitioner would then rotate the handle, leveraging the tooth out of its socket. The intention was to use the jawbone as a fulcrum. The reality was often a disaster. The tooth might shatter, leaving roots embedded deep within the bone. The jawbone itself could fracture. The surrounding teeth, supporting ligaments and gums would be severely traumatized. It was a tool of immense power, wielded without understanding, causing immense collateral damage. Imagine the agonizing splintering sound, the tearing of flesh, the searing pain as a tooth key wrenched a tooth from its very foundation. Another common extraction tool was the pelican, a precursor to modern forceps, often featuring a claw or beak-like end and a fulcrum. It worked by gripping the tooth and then using leverage to pull or pry it out. Like the tooth key, it relied on crude force, and precision was a foreign concept. The curved, clawed end was designed to hook around the tooth, and then, using a pivot point, usually on the adjacent gum, the tooth would be literally ripped from its socket. The chances of breaking the tooth, crushing the bone, or severely damaging neighboring structures were incredibly high. These tools were often made by local blacksmiths, crafted for strength and utility rather than sterility or anatomical consideration. Beyond these specific extraction devices, the barber surgeon's arsenal included rudimentary forceps and pliers, often borrowed from other trades, or simply multi-purpose tools that could grasp and pull. These were essentially heavy-duty pincers, lacking the delicate ergonomic design or varied tips of modern dental forceps. Their gripping surfaces were often smooth, leading to slippage, or too sharp, crushing the crown of the tooth instead of securing a firm hold. For lancing abscesses or performing crude gum excisions, knives and lancets were employed. These were simple, sharp blades, again, completely unsterilized. The act of puncturing a swollen, pus-filled gum with a crude knife, knowing that every microbe on that blade was about to be introduced deeper into your infected tissues, would have been a horrifying realization. If the patient even survived the initial agony and trauma to reflect on it. And for stopping bleeding, a truly terrifying method often employed was cauterization. A heated iron rod, perhaps one still glowing from the forge, would be applied directly to the bleeding tissue. The smell of burning flesh, the searing pain, and the additional risk of infection from the contaminated iron speak to the absolute desperation and brutality of these procedures. Cauterization was a last resort for hemorrhaging, ensuring that the patient's experience was as agonizing and traumatic as humanly possible. It's impossible to overstate the impact of the complete absence of sterilization. The concept of microscopic organisms causing disease was centuries away from being discovered. A barber surgeon would move from cutting hair to extracting a tooth to lancing a boil without ever cleaning, let alone sterilizing, their instruments. Blood, pus, saliva, and various pathogens would accumulate on the surfaces of these tools, being directly introduced into open wounds during every procedure. This meant that any intervention, no matter how successful in removing the tooth or draining the pus, carried an almost guaranteed risk of severe, often fatal, secondary infection. A successful extraction might simply trade a toothache for sepsis or osteomyelitis, bone infection, proving a death sentence in disguise. So, when a medieval individual finally mustered the courage, or was driven by sheer, unendurable agony, to seek help for their dental torment, what could they actually expect? Tooth extraction was by far the most common procedure. For the medieval dentist, a problematic tooth was almost always a condemned tooth. Preservation was not an option. The goal was simply removal. The patient would typically be seated on a hard stool, or even the floor. Restraint was often necessary, not because patients were inherently uncooperative, but because the pain was so intense that involuntary movements were inevitable. Strong assistants or family members might hold the patient down. As for anesthesia, as discussed, alcohol was the primary option, often administered liberally, if available. Some might offer a sleep sponge soaked in opium, mandrake, or hemlock, but these were dangerous, unpredictable, and rarely induced a true state of unconsciousness without risking a toxic overdose. More often, the patient was simply expected to endure, to grit their teeth, to pray. The actual extraction was a scene of unmitigated horror. The chosen instrument, be it a tooth key, a pelican, or a pair of robust pliers, would be applied. There was no gentle rocking, no careful loosening of ligaments. It was a wrench, a pull, a twist, a brute tearing force. The sound alone would be sickening. The crunch of bone, the tearing of gums, the crack of the tooth itself as it resisted the onslaught. The patient's screams would be piercing, choked, and desperate. Blood would gush, mixing with saliva and pus. It was a messy, violent affair, often taking multiple attempts, each one as agonizing as the last. The complications were manifold and devastating. The tooth might break, leaving fragments or roots embedded in the jawbone, leading to continued infection, chronic pain, and an even more difficult, painful subsequent extraction attempt. The jawbone itself could fracture, a catastrophic injury leading to severe deformity, inability to eat, and a high likelihood of infection and death. Severe bleeding was common, and without proper methods of hemostasis, this could be life-threatening. And as mentioned, infection was almost a certainty, given the unsanitary conditions and instruments. The act of extraction, far from resolving the problem, often simply initiated a new, equally terrifying phase of suffering. Post-extraction care was virtually non-existent beyond perhaps rinsing the mouth with water or wine. There were no antibiotics, no pain management beyond what little herbal concoctions might be available, and no advice on how to prevent further infection. The psychological trauma of such an experience would have been profound and lasting, etching itself into the memory of the survivor. Lancing an abscess was another procedure, often the only intervention for a raging infection. Once swelling became severe and pus was evident, a barber surgeon might use a sharp knife or lancet to puncture the abscess and drain the accumulated pus. While this provided immediate, albeit temporary, relief from pressure, the act itself was excruciating. And again, utterly unsterile. Draining the pus, while seemingly beneficial, opened a direct pathway for external bacteria to enter the already compromised tissues, often leading to a wider, more systemic infection. The relief would be short-lived if the underlying infection wasn't resolved, which, without antibiotics, it rarely was. The concept of filling cavities was almost non-existent. While some ancient civilizations, like the Romans, had experimented with crude fillings for aesthetic purposes, and later Islamic scholars made advancements, medieval European dentistry offered very little in this regard. If a cavity was too large or too painful to ignore, but the tooth wasn't yet condemned for extraction, some incredibly primitive attempts might be made. These might involve packing the cavity with wax, crude resins, lead with its own toxic side effects, or even cotton soaked in various herbal concoctions, primarily to provide a temporary barrier against food particles and offer some palliative relief, not to restore tooth structure or function. There was no concept of drilling out decay precisely. Any removal of decayed tissue would have been done crudely with a sharp, unsterile pick or knife, causing immense pain and likely leaving much of the decay behind. Cleaning or scaling was also rudimentary. Some practitioners might attempt to scrape away visible tartar with small, sharp instruments, but this was more for aesthetic purposes or to alleviate severe gingivitis rather than a systematic approach to oral health. It was a painful and incomplete process, often causing more damage to the gums than benefit to the teeth. Beyond these direct interventions, medieval dentistry often involved practices based on the prevailing medical theories of the time, particularly the humoral theory. This theory, inherited from ancient Greek medicine, posited that the body contained 4 primary humors: blood, phlegm, yellow bile, and black bile, and that disease resulted from an imbalance of these humors. Therefore, practices like bloodletting or cupping might be prescribed for a toothache, on the belief that it would rebalance the humors or draw out bad blood from the affected area. While these practices were unrelated to the true cause of dental pain, they were deeply ingrained in medieval medical thought and often performed by the same barber surgeons. The irony was that these cures often weakened the patient further, making them more susceptible to the actual infection. Finally, for the majority of the population who couldn't afford or access a barber surgeon, or for those who believed in supernatural causes, topical applications, poultices, and herbal pastes were common. These might include crushed herbs like dill, cloves, known for their eugenol, a mild anesthetic, but very limited in effect for severe pain, opium poppy, or more dangerously, henbane or mandrake root. These were applied directly to the painful tooth or gum, offering at best temporary, mild relief and at worst, causing irritation, allergic reactions, or systemic poisoning if absorbed. These were desperate measures, often employed while the underlying infection silently raged. The medieval mind, confronting pain and disease without scientific understanding, naturally turned to the supernatural. Alternative cures and superstitions were rampant. often providing more psychological comfort than actual medical benefit. People clung to them with a fervent belief born of desperation. Charms and amulets were widely used. And rabbits, foot, a wolf's tooth, various stones, or specially inscribed pieces of parchment might be worn around the neck or placed against the offending tooth, believed to ward off evil spirits or absorb pain. Each region, each village, had its own specific set of charms and rituals, passed down through generations. These were not just quaint beliefs. For many, they were a genuine, often fervent, attempt to exert some control over an uncontrollable. Agony, magical rituals and incantations were also common. Spells whispered over the patient, often invoking saints or deities, or attempting to curse the toothworm, a common medieval belief that tooth decay was caused by tiny worms gnawing at the tooth, were regularly practiced. The belief in the toothworm was so prevalent that even some early medical texts described methods to smoke out or extract these mythical creatures. Religious relics were sought after by pilgrims and the faithful. Touching the bone of a saint, drinking water that had flowed over a holy artifact, or praying at a sacred shrine were all believed to offer miraculous healing from any ailment, including toothache. The efficacy was, of course, purely psychological, a testament to the power of belief in an age of profound religious devotion. And then there were the truly bizarre and horrifying folk remedies. The practice of urine therapy, specifically, rinsing the mouth with one's own fresh urine, was believed by some to cleanse the mouth and strengthen teeth. The ammonia content might have offered a temporary sense of cleanliness, but the overall effect was minimal and obviously highly unsanitary. Another grim belief, recorded in some historical texts, involved eating a mouse, raw, cooked, or powdered, as a cure for toothache. The sheer disgust of such a remedy speaks volumes about the depth of medieval suffering and the willingness to try anything, no matter how repulsive, for relief. Fumigation was another method stemming from the toothworm theory. The patient would hold their mouth open over a burning concoction of herbs, seeds, like henbane seeds, or even animal droppings, in the belief that the smoke would drive out or kill the worms supposedly residing in the tooth. While it might have provided some transient relief through the mild analgesic properties of some herbs, the smoke was often acrid and potentially harmful, and the concept itself utterly baseless. The long-term consequences of untreated or inadequately treated dental disease in the medieval period were catastrophic, extending far beyond the immediate agony. Chronic, unremitting pain became a constant companion for millions, eroding their quality of life, their ability to work, and their mental well-being. Imagine living day in and day out with a throbbing, festering infection, constantly fatigued. From lack of sleep, unable to focus on anything but the relentless agony. The most direct physical consequence was difficulty eating. Missing teeth, painful abscesses, and inflamed gums made chewing arduous, if not impossible. This often led to malnutrition, further weakening the body and making it more susceptible to other diseases. A weakened immune system meant that infections, including those stemming from the mouth, were more likely to spread and become fatal. Speech impediments were common, as missing teeth or swollen jaws could significantly affect articulation, impacting communication and social interaction. Facial disfigurement was another grim reality. Untreated abscesses could swell to grotesque proportions, distorting features, and sometimes leading to fistulas that drained pus directly onto the face. Repeated extractions, often traumatic, could lead to bone loss and a sunken facial appearance. These deformities carried a significant social stigma, impacting personal relationships and employment prospects. But perhaps the most insidious and deadly consequences were the systemic infections. We touched on this earlier, but it warrants reiteration due to its profound impact. A dental abscess was not just a localized problem. It was a gateway for virulent bacteria to enter the bloodstream. From there, they could travel anywhere in the body, leading to sepsis, blood poisoning, a systemic inflammatory response that could rapidly lead to organ failure, shock, and death. It was a common and terrifying end for many medieval individuals suffering from dental infections. Endocarditis, an infection of the heart's inner lining or valves, often fatal. Brain abscesses, bacteria traveling to the brain, forming pus-filled pockets, leading to neurological damage, seizures, paralysis, and death. Osteomyelitis, infection of the jawbone itself, causing chronic pain, bone destruction, and the formation of draining sinuses. Ludwig's angina, a rapidly spreading infection of the soft tissues of the mouth and neck, which could cause the airway to swell shut, leading to suffocation. These were not rare occurrences. They were a common and brutal pathway to death, stemming from what we now consider a treatable, even minor, ailment. The medieval person carried a constant, silent threat in their mouth. Beyond the physical, there was the profound impact on overall. Quality of life, chronic pain, disfigurement, and the constant threat of infection made life an arduous journey. Productivity would plummet, livelihoods would be lost, and personal relationships strained. The medieval world was one where illness was accepted as a part of life, often seen as divine punishment or a test of faith. This fatalism, while offering some psychological framework for endurance, did little to alleviate the actual suffering. It's also worth noting that while our focus is primarily on Western Europe during the medieval period, there were indeed regional variations and some glimmers of advancements particularly outside of the rigid confines of European medical traditions. For instance, the Islamic Golden Age, roughly contemporaneous with the early and high medieval periods in Europe, saw significant medical advancements, including in the field of dentistry. Scholars like Avicenna, Ibn Sina, Reza al-Razi, and Abulcasis al-Zahrawi wrote extensive medical texts that included descriptions of dental tools, procedures, and remedies that were far more sophisticated than anything commonly practiced in medieval Europe. Abulcasis, for example, described various types of dental forceps, scrapers for removing tartar, and even methods for replanting teeth. Their understanding of anatomy and hygiene, while still lacking germ theory, was generally more advanced, influenced by translations of Greek texts and their own empirical observations. However, these advancements were largely confined to the Islamic world and had limited direct influence on everyday dental practices in most of medieval Europe. The slow, glacial pace of change in medical knowledge and practice meant that genuine innovation was rare and often localized. Some European physicians did begin to write more systematically about medicine and surgery towards the later medieval period. Figures like Guy de Chauliac, 14th century, and John of Ardres, 14th century. While not solely focused on dentistry, their extensive surgical treatises often included sections on oral ailments. Guy de Chauliac, for instance, described methods for extraction, cleaning teeth, and even applying fillings with crude materials. However, their knowledge was still limited by the prevailing theories of their time, and their practices, while perhaps slightly more refined than a village barber surgeon's, were still barbaric by modern standards. These were foundational texts, certainly, but they represented the very earliest, tentative steps towards anything resembling a professional, systematic approach to oral health. The vast majority of people, especially those in rural areas, would have never benefited from such theoretical advancements. The medieval period was also characterized by a profound social stratification, and this extended to dental suffering. While dental problems were universal, the response to them differed. The wealthy might have had access to slightly better fed surgeons, perhaps even some with a smattering of theoretical knowledge from nascent medical schools. They might have had a wider array of imported herbs or even small quantities of opium. But even for them, the underlying lack of scientific understanding, the absence of anesthesia and antisepsis, meant that their dental experiences, well, perhaps, in slightly more comfortable surroundings, were ultimately just as brutal and dangerous. The poor, on the other hand, had fewer choices, relying on folk remedies, the local barber, or the terrifying blacksmith. Their suffering was often compounded by malnutrition and the inability to escape their daily labors, even when consumed by agonizing pain. Let's now consider this worse than your worst nightmare angle in stark contrast to our modern reality. Today, a toothache, while unpleasant, is rarely life-threatening. We have a profession dedicated solely to oral health, highly trained dentists and specialists with decades of scientific research backing their practices. We have asterisk anesthesia, local anesthetics like lidocaine that numb the entire area, allowing for pain-free procedures, sedation options for anxious patients, general anesthesia for complex surgeries, asterisk antisepsis and sterilization. Every instrument is meticulously sterilized, preventing cross-contamination and infection. Surgeons operate in sterile environments, reducing the risk of post-operative complications to a fraction of what they once were. Asterisk advanced imaging, X-rays, CT scans, and other imaging technologies allow dentists to see precisely what's happening beneath the surface, enabling accurate diagnosis and treatment planning. Asterisk precision tools, high-speed drills that remove decay efficiently and painlessly, ultrasonic scalers that clean teeth gently, microsurgical instruments that allow for delicate, precise work, preserving healthy tooth structure. Asterisk restorative materials, strong, durable, biocompatible filling materials, composites, amalgam, porcelain that restore the tooth structure and function, root canal therapy to save infected teeth, crowns, bridges, and implants to replace missing teeth effectively, asterisk preventative care, fluoride, regular cleanings, dental hygiene education, and dietary advice that prevent most dental problems from ever developing in the first place. Asterisk antibiotics, powerful drugs that can swiftly eliminate bacterial infections, preventing them from spreading and becoming systemic. The transformation is nothing short of miraculous. What was once a guaranteed path to excruciating pain, disfigurement, and often death is now a routine, often pain-free, visit to a dental professional. A medieval person could never have conceived of such comfort, such efficacy, such safety. Their reality was one of stoic endurance, desperate remedies, and a constant, pervasive fear of dental disease. The sounds of their suffering, the screams, the moans, the prayers for release, echo through the centuries, a chilling reminder of how far we have come. In conclusion, the history of medieval dentistry is not just a tale of crude tools and barbaric practices. It is a profound testament to the sheer resilience of the human spirit in the face of unimaginable suffering. It is a mirror reflecting a world where pain was an inescapable companion, where ignorance of the unseen microbial world led to horrific preventable deaths, and where the most basic understanding of hygiene was utterly absent. It highlights the vast chasm between pre-scientific beliefs and modern medical knowledge, a chasm filled with centuries of agony, fear, and desperate, futile attempts at relief. The medieval toothache was indeed worse than your worst nightmare, because it was a nightmare from which there was often no awakening, only the slow descent into deeper suffering or an early grave. So the next time you visit your dentist, and perhaps feel a fleeting moment of apprehension, take a deep breath. Remember the medieval person, clutching their jaw, their face swollen, their life hanging by a thread, and offer a silent prayer. of gratitude for the profound blessings of modern dentistry. We truly stand on the shoulders of centuries of suffering, now privileged with comforts and cures that our ancestors could only dream of. In speaking of unmasking the forgotten horrors and untold stories of the past, if you've been captivated by this deep dive into medieval agony, if you felt that shudder of appreciation for modern advancements, then you know what to do. Hit that subscribe button. Ring that notification bell. Join the Historian Sleepless community, and let's continue to explore the often grim, always fascinating, and endlessly educational truths of history together. Your support truly makes it possible to bring these stories, from the utterly terrifying to the surprisingly inspiring, to light. Thank you for enduring this journey with us.